It's a pleasant Sunday morning to you all. Good morning and welcome. It's Sunday morning live on FM here in the studios of OGBC 90.5 in Abeokuta. Thank God it's the last Sunday of the year. Today, 29th day in the month of December, year of our Lord 2024. Today, we are taking a look at issues relating to public health. And so, to talk about this, we have brought in an expert in the field. He is a medical doctor, and as we speak, he's a minister of the Federal Republic. Our guest is an exemplary, humble personality, a great organizer, strategic thinker, excellent leader, and a dedicated family man with a high sense of responsibility. Our guest is Dr. Ishaq Salako, who is today the Honorable Minister of State for Health and Social Welfare. He is an indigene of Ogate. He had his secondary education and he had his A levels at the then Moshood Abiola Technic in Abeokuta here before proceeding to University of Lagos, where a Bachelor of Science degree in Medicine and Surgery in 1992. Our guest during his national service at Onitsha General Hospital in Old Abia State, in Old Enugu State, now because of in Old Abia State, he volunteered as a member of the National Guinea Worm Eradication Program and contributed to the eradication of the disease in the state. For his contribution, he was given the Golden Handshake Award by former President Jimmy Carter and also won the NYSC Merit Award in Abia State. That was then. Dr. Salako is a public health physician with a master's degree in public health, a health activist, politician, environmentalist, public analyst, and community mobilizer. He is on the final stage of his PhD program in public health, specializing in health policy and management. Dr. Salako is a man of many parts. His charity and community service level, at that level, Dr. Salako was the National Secretary of Yewa Awori Youth Agenda Forum, YAYAF, Chairman, Gateway Agenda, Pioneer President, Major Noble Club of Ayetoro, several other social groups like that. He was commissioner in Ogun State and served in 3 strategic ministries and health. He was also a gubernatorial aspirant in Ogun State in year 2010. As a commissioner in Ogun State, Dr. Salako introduced many innovative programs and projects, including the Ogun State Catch Crop Policy, which was used to put Ogun State in the leadership position for the farming of cocoa, cotton, cassava, and upland rice. He introduced the Abosimi housing scheme to help retiring civil servants in Ogun State plan for their retirement house. As Commissioner for Health, Dr. Salako introduced the Primary Health Care Award for local government and equally introduced health status screening to the then Ogun State Rural Medical Scheme, OGRUMED, just to mention a few. In 2020, he was appointed as the chairman of Ogun State Hospital Management Board, where he made his mark through innovation of selected general hospitals, equipment updates, staff recruitment, human capacity development, and the introduction of quarterly HMB bulletin. He was appointed by President Bola Tinubu, GCFR, in August 2023 as the Honorable Minister of State for Environment, becoming the first minister from Ogun West Senatorial District since the inception of the current democratic dispensation in 1999. Did a lot of innovations in that ministry, including nature-based solution among others. As we speak, since October of this year, he has been the Minister of State for Health and Social Welfare, a position he assumed in October 2024. A widely traveled man who has presented papers in different parts, both locally and internationally. He is the recipient of many awards, including the National Youth Service Merit Award in Old Abia State, Crystal Award of Excellence of Veterinary Medical Association of Nigeria, among others. He's a devout Muslim, married to Dr. Riskat Oluremi Salako, a public health microbiologist, and the union is blessed with wonderful children. Dr. Salako, you're welcome to the studios of OGBC this morning, sir.
Well, thank you very much. It's good to be back here. And let me use the opportunity to wish all Nigerians happy celebration, especially my people in Ogun State.
we'll say homecoming once again.
Thank you.
Sir, we are in the festive period. The last couple of days, Nigerians have joined the rest of the world in celebrating the Christmas, and we are waiting the new year, which is just about 3 days from now. In terms of public health, how should we live in this festive period? It's a moment of, or it's a period of wine and dining. It's a period where you go to different places, you see people defecating in different directions because they must have overfed or they must have fed beyond the limit. How should we live during this festive period? Let me start from there.
All right. Once again, thank you very much for having me. First, let me say that it's a good thing for all of us to see the 2024 Christmas period and to start preparing ourselves towards the new year of 2025. It's a celebration period, like you said, but basically we must be moderate in our celebration. There's a lot of whining and dining, a lot of drinking. There must be moderation in what we eat. There must be moderation in what we drink. For those of us who go to parties, let us not drink and drive. If you know you are tipsy, better you stay behind or get somebody who is has not drunk or is not tipsy to drive, so that we reduce the possibilities of road traffic accident happening. It's important for us to ensure that our food sources are well scrutinized. We should not just eat anything because at this period we have higher incidence of food poisoning, higher incidence of cholera and other foodborne diseases. So we must be wary of what we eat and where the food is coming from. We must ensure that the basic hygiene that we normally keep is we keep it more during this period, washing our hands regularly, ensuring that the sources of water that we drink uh, is clean. We should not just drink any kind of water. The period that we're likely to be susceptible to that because of the crowd of celebration. And then when we go to parties or in a crowded environments, we should also be careful, ensure that there's adequate ventilation, ensure there is no organization, that there's no stampede. Um, and then if you are ill, for example, you are running cold and all that, it's better to stay at home rather than to go and then spread the infection. So that is very important. This is also a period for us to be very security conscious, so that we do not unnecessarily expose ourselves to dangers. Let's not travel at night, not walk in dark alleys and dark places. Be wary of the kind of company that we keep. So general security consciousness and being careful are all needed at this period so that we can guide against any unforeseen circumstances that may lead to accident or injuries, and then expose us to going to hospitals.
Take a look at some of the areas of interest to you because you are a right peg in the right hole, a medical minister of health. You don't know that about that. And when you were in Ogun State, here it's on records that you anchored the revival of some of the general hospitals. Are you going to transform that at a national level now that you are now holding a national portfolio?
Thank you once again. Well, the health sector in our country, under President Bola Ahmed Tinubu GCFR, can be said to be better in the front burner. The president himself actually mentioned that sometimes earlier this year, saying that one of his key agenda is to bring health back at the front burner. And I think that if you look at some of the things that Mr. President is doing in terms of allocation of resources, in terms of his executive orders, in terms of the enablement that have been given to the health sector, you will see clearly that the health sector is in the front burner. You see that there are a lot of renovation going on in most of our medical centers, teaching hospitals, federal medical centers, specialist hospitals. You see a lot of effort going on with revival of our primary health care, and you see that across the nation, the objective of Nigeria to ensure that at least one comprehensive primary health care center is available per ward is on stream. And today, up to over 7,000 healthcare centers have been certified as level 2 healthcare centers. And our intention is to continue this over the next 2-3 years to ensure that we're able to deliver on that objective to get one health center available. We also see that For example, earlier this year, we had the president approve the the establishment of cancer centers, and procurement for 3 of those cancer centers has reached an advanced stage. And our plan is that by this new year, we also procure for additional cancer centers so that our people who suffer cancer doesn't need to travel far. So this is being spread across the geopolitical zones of the country. You also see that the president is also doing a lot with respect to unlocking the value chain, so that we have a situation where the health sector is not just a consumer. The health sector is also a producer in terms of producing consumables, producing drugs, producing inputs, diagnostics kits, and so on. That with that will can also generate a lot of employment, create wealth, generate economic activities, and also add to the economic indices of Nigeria. So these are some of the key priorities of Mr. President that we are implementing on the health sector renewal investment initiative of Mr. President.
Would that initiative not be hampered by the high level of relocation of Nigerian medical officials to foreign countries? This we call it Japa syndrome in Nigerian parlance. Don't you think that will have a kind of negative effect on it? How do you get manpower to run some of these cancer centers and other health facilities across the country?
Well, the migration of health workers is, but it has both its positive and negative sides. First is that we don't want people that we have trained, that Nigeria has invested a lot of resources on, to now graduate and then move out of the country, whereas they should stay behind and serve Nigerians. But the positive side is that when they move, they also have the opportunity to get exposure, to interact with health professionals across the world, and able to gain more experience, more skills, which they can bring back to also serve Nigerians. So what we're trying to do is to ensure that we balance that. As much as possible, we cannot stop everything going, but with the initiative of Mr. President to improve the general health architecture in the country, a lot more people are now willing to stay. And then we're also taking advantage of technology to ensure there's a lot of input, even from when you are outside through telemedicine. You can also contribute to healthcare in this country. So we now have a committee directly working with our healthcare professionals in diaspora, and we engage them on a regular basis. Some of them even come for health missions to contribute to the health sector in the country. So balancing that is one of the things we are doing. Beyond that, we are also expanding our ability to train and graduate healthcare professionals. So you see that we are establishing new medical schools, we are establishing new nursing schools. We have also increased the ability, the quota of some of our schools, so that they can be able to turn out more personnel. Because when we are able to turn out more personnel, those who want to go can go, but we're able to also retain some
You
of
still have
them.
a reservoir.
Yeah, we still have a reservoir. Again, we are also gotten the situation where the process for recruitment in the health sector have been kind of reduced. The civil service generally have its own process for recruitment of the health sector, and this challenge of the president has given us a kind of waiver where we can use the process of recruitment, and then we're able to recruit health workers more quickly than any other sector in the country. So with all this added together, we're able to ensure that despite the Japa syndrome, we still are able to retain quite a good quality of our people. We're also able to tap from those who are outside, and we're able to also turn in more healthcare professionals, so that the issue of human resources does not affect our agenda.
Dr. Salako, let me quickly ask you this one. When you were Honorable Minister of State for Environment and Ecological Management, there was this promo that I always see on the TV where you say you tell Nigerians not to poach animals, not to endanger the species of certain animals, not to allow them to go into extinction. Now you have left that ministry, and now you're Minister of Health, your primary constituency. What is your agenda for Ministry of Health as a minister?
Well, my agenda as a minister is situated largely within the National Health Sector Renewal Initiative, which has 4 key pillars. A pillar of ensuring that the governance structure for our health system is better. You know that sometimes in 2014, the National Health Act was passed and assented to by the former president. But the implementation of that health act has not been robust enough. Under President Bola Ahmed Tinubu, the implementation is much more robust now. We're able to ensure that the Nigerian health system, from the national level to the state level, to the local government, the ward level, the village level, including the private sector, and also the traditional practitioners, are brought into one basket as the Nigerian health system, so that the governance is more seamless and everybody is speaking one language, everybody has one plan, everybody has one budget, and we're using the same level of evaluation to evaluate ourselves. That is one key agenda. Within that governance structure, we also have what we call the agenda to ensure that the quality of healthcare, we're able to deliver healthcare in an efficient manner, in an equitable manner, and also in a quantitative manner.
Okay.
So we will see me as Minister of State emphasizing a lot on quality of healthcare, because each time I say that when we build hospitals, when we buy ambulances, when we employ health workers, the whole essence is to be able to deliver quality healthcare to Nigerians, so that when Nigerians go to our hospitals, their experience should be top notch. They should not go there and feel that they've not been taken proper care of. Even if at the end of the day, if you go to a hospital and, for example, what you have is probably a terminal disease and the doctors are not able to cure that disease, but you should be able also to be able to, these people have offered me the best to their ability, to be a top priority in our agenda to ensure that the perception, the experience of people who visit our hospital is top notch. Under the unlocking value chain, the president has also issued an executive order to ensure that we are able to promote our local ability to manufacture drugs and inputs, including the consumables, including test kits. Now, one key area of that is to also see how we're going to increase our own traditional phytomedicine resources. You see, as a country, as a people, we also have our own traditional ways of doing some of these things. Some of uh, these traditional resources, if we're able to subject it to universal model of assessment, universal model of trials, universal model of rating, we can also make some of those traditional phytomedicine available to our doctors, to our health workers, so that people can also take benefit of that. So we are going to also see that as a top priority in our agenda. The other point is that, generally speaking,
Yes.
Nigeria, in as much as we are making progress in terms of infectious diseases, but we are also confronted with a lot of non-communicable diseases, hypertension, diabetes, ailments, and so on and so forth. Whereas most of these illnesses, non-communicable diseases, are preventable. So we're going to also focus a lot of attention on how to prevent these sort of diseases, because we don't want people to get ill and go to hospitals. We will rather focus on preventing people from getting ill at all. And that is why your first question about what should people be doing about these festivals and everything is a very good question, because our objective is not for people to get ill.
Okay.
Our objective is, as much as possible, we reduce the level of the level of disease burden in. So you see us emphasizing a lot on preventive. And the new year, we're going to do a lot of activities on how to ensure that people are able to take measures in terms of physical activities, in terms of their diet, in terms of their habits, in terms of reducing smoking, reducing alcohol consumption, in terms of ensuring that they check their health regularly, so that at the end of the day, we are able to prevent illnesses, we are able to reduce the burden of disease in our society. So, just in a summary, those are some of the highlights of our priorities as Minister of State for Health.
Thank you very much for the explanation, Honorable Minister of State for Health and Social Wellbeing. It's Sunday morning live on FM here in the studios of OGBC 90.5. You can also listen to this program on Radio Garden at Ogu Radio FM 90.5. You can equally follow us on our website, oguradio.ng, listen live. You can equally watch us live on our Facebook and YouTube page at Ogun Radio Abeokuta. You can follow us and share it, because when you follow and share, you spread the message, and that is the essence of this program. We still have with us the Honorable Minister of State in our studio, Dr. Ishaq Salako. He's been answering questions and is going to answer more because of the volume of questions that are in front of him this wonderful Sunday morning. The lines are blinking. But before I go to the lines, Honorable Minister, when you take a look at federal medical institutions in Nigeria, I understand there is a University of Medicine springing up somewhere in Ogun State. What is the state of that university?
I think a lot in terms of the necessary laws have been passed.
Okay.
The site has been acquired. Some budgetary provision hopefully will be provided this budgetary session, this 2025, so that infrastructure development can also commence in that university. So we're making progress with respect to that, and we hope that all things being equal within the next by the next budgetary session, we may be able to start some level of activities. Already, we have the Federal Medical Center, Idiaba, which can serve as the take-off ground for some of the people that we are going to admit in spending the time that will also be fully developed. But a lot of progress has been made with respect to that University of Medicine.
A couple of months back, some of these pharmaceutical companies that produce drugs started leaving Nigeria. Aren't you worried as a health professional?
Well, I think that if you look at that, well, first is that it is not only pharmaceutical products that are affected. Manufacturers are basically out for profits. But what I can tell you is that people are leaving. Some people, I can tell you that in the last 1 year or thereabouts, specifically within the health sector,
Yes.
we must have signed a memorandum of understanding with not less than 11 companies who are coming into Nigeria. Some to manufacture test kits. For example, Abbott is coming into Nigeria from South Africa. We have some of our even indigenous manufacturers like Fixing manufacturing lines to also manufacture HIV drugs, for example, in Nigeria. We have companies coming in to manufacture ultrasound scan machines, and so on and so forth. So some are leaving, some are coming in. That is the way the global economy is, very competitive and very mobile. So, but I assure you that the strategy of Mr. President and the policy that has been put in place, I expect that in the next 1 year, Nigeria will be a little more self-sufficient with respect to pharmaceuticals, with respect to consumables in the health sector.
Rounds that there was another occurrence of a variant of COVID. What is the NSCDC under your control, the Ministry of Health at the federal level, doing to check this?
Well, as I speak with you, we do not have any report of that new variant in Nigeria. And the strategy is to ensure that we have a robust surveillance mechanism in our borders, both at the ports, the land, and the sea borders, to ensure that people who come in are screened adequately, so that we're able to easily and early detect the importation of such strains into our country. So that surveillance system is on very effectively. So we also have developed the capacity of the National Institute of Medical Research, Lagos, to be able to quickly test samples that are collected from people who are coming into the country, and easily also early detect such variant. So what we have at the moment is a robust mechanism to do surveillance to ensure that we're able to, if such happens, we're able to detect very early.
Okay, thank you very much, Honorable Minister. From our Facebook page, there are reactions already. Prince Adeshola Musedik, Mariam O.A. Ajibo JP, from the Facebook page. And the fourth person, Tunde Kamorudin Lawal, they said those are good initiatives and agenda of Mr. President, which the Honorable Minister of State for Health and Social Welfare has been implementing for the benefit of the people of Nigeria, of this great nation. Thank you for your time with us on the Facebook page. Adeshola Musedik, O.A. Mariam Ajibo JP, and Tunde Kamaludin. Follow us more, share it, and then continue to be part of the program on all our social media. The numbers to call are 0803 437 9453, 0815 032 0226 are the two hotlines to call this morning to be part of this discourse. We are taking a look at the season of merriment, what we should take, what we should not take. Then we are now dovetailing to the health sector renewal of the federal government, in which the Honorable Minister of State for Health and Social Welfare is representing here in the studios. The numbers to dial once again, 0803 437 9453. Good morning to you. Yes, and your name and where you are calling from.
Good morning.
Now, I had this assumption that in our mosque, especially on Friday, in our churches, especially on Sunday, we need to make people or to have a sense of themselves. People are dying, people are sick. You won't believe it. And for us to mention that the kind of way people are living is causing some of the events. Now, let me have a sort of hour or let me say 30 minutes for these people or the members to be coming to the church and mosque to bring to enlighten people on the way to be a modern guy. Now, secondly, we have some others and some us and in some place that they are predominantly with us there. And if you use it, for example, in the olden days, they just use maybe a sheep and then the people will go away some other argument. Then we justify this by making sure that we incorporate the sort of other into our system, into our medical system.
Okay.
Thank you, and
Thank you so much for your time with us this morning. 0815 032. Yeah. Yes, sir. Thank you. And where you are calling from?
Good morning. Thank you very much.
Go ahead, sir.
Please go ahead.
Nigeria today, the issue of environmental pollution has been a great concern. Let's start several studies, let's start several meetings, conferences, and seminars. Our environment will remain heavily polluted by yet. Pollution continues to arise from so many sources. Incidents of water pollution, soil pollution, and air pollution have been prevalent in Nigeria, and this situation, as I say, is dangerous to health. So you as an expert in public sector and a medical practitioner, I want to know from you the solution to this problem. What is the way forward to all these environmental challenges towards the promotion of health in our society? I thank you very much for your listening.
Thank you so much,
Thank
Mr. Olatunde Ajayi. 0803 437 9453, 0815 032 0226. Hello, good morning. Can you move away from your radio set? Thanks for calling. Alaji, can you move away from your radio set? You still need to move away from your radio set, or you switch it off. Thank you very much. You are clearer now.
his advocacy for progress. I just want to ask some questions.
Okay.
Number one, on the issue of drugs, some drugs for diabetes, hypertension, and other diseases are very, very expensive. And recently, about some 2 months ago, around the president passed the elected order for the prevention and types of these drugs. So what are they doing? Because people working now, just as we are saying, some of these are elderly who are making like this invest. Come down. And then, what is the best people to do to achieve? I mean, all over the country, a lot of challenges are facing the sector. In terms of, we are talking about the doing. I mean, doctors, let's say, within the country, those are the all these things. So please, let me look into assist all these areas.
Okay.
Thank you very much. I like Popola from OTK.
Thank you very much, Alaji Popola. 003 437 9453 0815 032 0226. Thanks for calling.
I'm Elsie from Africa.
Good morning to you, Kayode.
Good morning, sir.
Good morning, Mr. Kayode.
Thank you, sir. Welcome for a long time, sir. Happy New Year, sir. To me, for me, to bring it back to our nation, just like you told us that President Tinubu was about or asked the ground to do something. I think we need a lot of a kind of dissemination of information and more of addressing the issue of our people that are probably derailed from how to speak, frame, focus, inside their cars or vehicles. I noticed that it's of course every now and then, I forgot, even over the years, that on environmental health like this, understanding matters. But because we are no more under the military or in the military era, people just speak anywhere, anyhow, their flame or focus. And then that way, what is in your understanding, sir? And characteristics like this, probably should put it in their task or in one line up, and then probably when they get back, they do it. Because it happens that somebody was on the time sometime, and then it speaks on another person in the passenger at the back. If not for that person during COVID that we had a nose mask or something like that, well, nobody knows what would have probably caused in terms of illness or diseases to that passenger.
Okay.
But what I'm trying to drive home about is that we need a kind of environmental solution to certain issues. This type of things, you cannot see it when it spreads around and spreads like that. And when they probably call for probably do a lot of things like this. So only 15% of the population know exactly what they needed to do. But what about the larger mass of the people who couldn't even know their right from left? And they do all these type of things every now and then. That's one. The number two, finally, sir, this issue of environmental problems. We have amongst climate change, pollution. Pollution matters to me most, and it's about noise pollution. And what are you doing, sir? Since you are in that terms of affair, the terms of affair now, in terms of amendment of our constitution or probably breaking new law or legislation to the issue of noise pollution coming from mosques or church or churches, thereby they are turned churches, mosques to clubhouses that they take drums, things like that, at the detriment of those people that are ill or sick, even nearer them, even not nearer, and that's most of them leave their speakers outside as well, even those that are not putting their speakers outside. They normally think that they own everybody, they just can't do anything here.
Okay, let the minister attend to them.
Sorry, what do you see the reason why we must allow our environmental law officers to take
Let him answer the question. You have asked the question. Let him attend to them. Thank you very much, Kayode. Yeah, you have answered the question. I mean, you asked the question. Let him attend to them. Thank you very much. 003. Okay, let's add this one. Honorable Minister will now come back and take reactions. Good morning to you. Thank you so much, sir. Thanks for calling. Okay.
I can let my guest here. May I know from you that the best position way to sleep is it by right hand side or left hand side or lying down or back? I'd like to hear from you, sir. Thank you very much, sir.
Okay. Alagbatawo, he must be a retiree. Much for that. It's a more comical relief. At the same time, Honorable Minister, you heard him. Let's have your reactions on some of these calls that have been.
All right, thank you. I think I will start with the best position to sleep. Generally speaking, the best is what they call right lateral side. Is lying on your side, on your right side. It's called right lateral medically. That's lying on your right side, But we know that for whatever reasons, that lateral may not be comfortable for some people. Basically, the general advice is that first, if it's a pregnant woman, for example, we advise the pregnant woman should not sleep with the back facing up, because the fetus will now be resting on the abdominal aorta of the woman. For some elderly people, when they sleep, I don't know how to describe it in a way that people understand easily. When they sleep and they get up, they feel dizzy. So such elderly people, we normally advise them to raise the head of the pillow a little. Some may also have some health conditions. For example, people who have some maybe heart failure. The way they need to sleep will also be depending on those health conditions. But generally speaking, the right lateral side is the advisable side. But that may vary based on health condition and the situation of that person. Now, to Kayode, on environmental issues, and I'm going to link that with I think the question asks on the challenge of environmental pollution by Olatunde Ajayi.
Yes.
Well, basically, what I can tell you is that we know that, generally speaking, the medical services itself contributes maybe about 30% to the health status of the people.
Okay.
So other factors that we call the social determinants, including the environment, the food we eat, the level of our education, the kind of job we do, also play a significant role in our health status. So environment is very, very important. That is why we have what we call the One Health approach. The One Health approach means that the health sector, the environment sector, the agricultural sector, the water resources sector works together as one team to ensure, because these four key areas are very important to the health of the people. If you do not have good water, there's nothing the hospitals can do. A lot of people will still be going to the hospital. So the water source must be there. If you do not have good food, the health sector will not be able to cope. If the environment is not maintained, the health sector. So we have this approach. And I, as Minister of State for Health, one of the things that I've done is that I've appointed a special advisor on One Health, who is an environmentalist. And from my own background, as Minister of State for Environment, I know the importance of the environment in the health status of the people. So you will see that going forward, we are going to hype and put a lot of priority and prominence to issue of environmental cleanliness, hygiene, reducing level of pollution, working in consonance with the Ministry of Environment. Before I left the Ministry of Environment, one of the started is what I call Breathe Easy Nigeria, to promote clean air. And we are going to, going forward, work with that ministry to ensure that we're able to maintain, to improve the level of air quality in our country. With respect to noise pollution, of course, is a problem. But basically, the regulation of noise is within the ambit of the states. The states are permitted by law to regulate the level of noise that is allowed within the state. They can do laws, and they can sanction people who go against those laws. The federal government cannot, for example, enact laws to regulate noise level in Ogun and Zamfara. These are two different contexts. So Zamfara should be able to do his own. Ogun should be able to do his own based on the peculiarity of their state.
It should be under
concurrent. Yes,
list.
it's a concurrency. So, and if you look at what is happening in Lagos State, for example, Lagos State already has enacted a law to regulate the level of noise, even for religious houses. You know, so states are permitted to be able to regulate that. Talking about drugs for diabetes and hypertension is a very important question. Yes, I agree with you. The president issued an executive order which is supposed to remove some tariffs in some of these drugs that are brought in. We are working very actively to ensure to commence the implement. I've met with the custom because you see, to implement this kind of thing, it is not a health sector alone implementation. Cross-cutting thing. The custom has a role to play because it is custom that will implement the tariffs. The Federal Inland Revenue Service has a role to play. You know, the sector, we have a role to play. NAFDAC has a role to play. So there's already a robust discussion. And our expectation is that in the new year, the implementation proper of this executive order, which is able to some of these drugs, will start. And on our health talk in churches and mosques,
yes,
that's a very important initiative because, you know, like I said, if you do not focus on prevention, the health sector will not be able to cope. So we're going to work with not just religious leaders, community leaders, those who call gatekeepers in every community, influencers. We're going to be working with personalities, on-air personalities. We're going to be working with celebrities to ensure that we put a lot of health messages across to our people, and we hope that that can improve our practices with respect to health.
Well, let's go back to calls 0803-437-9453. Hello, good morning.
Hello, good morning.
Yes, sir, your name and where you are calling from?
My name is Ishaq. I'm calling from Ishaq.
Okay.
I got our guest speaker this morning. I would guess that your office is to education and environmental. My first question goes to education. Now, there are some common hospitals that they use NKI. Getting there, the drugs that are so expensive, you're not able to get it there. They say you go outside. Why? And this is NKI. And secondly, connecting the environmental issue, what can you do to assist our communities in local areas for conservation of their environment? It's a picture like the person to be on the way from Ogun State to where the environment they come to because there's some issue now in the environment on environmental. The tax that they used to dump the refuse in some areas. They are not rich, and people are just paying on the floor. Who can also get the help of people in their area?
Thank you. Thank you, Mr. Akitunde from Oshele. 0803-437-9453, 0815-032-0226. Good morning to you.
Good morning, Wale.
Yes, sir. Your name, sir?
Compliments of the season.
I wish you same.
My name is Pastor Shola Makinde, and I'm calling from Okebrewa, here. Dr. Ishaq, good morning, sir.
Good morning.
God bless you for me, sir.
Amen. Thank you.
You are doing very well. As the federal minister representing us in Abuja. Well done, doctor.
Thank you.
May the Lord continue to be with you and your family. In Jesus' mighty name.
Amen.
Now, doctor, as I always say to people around me, I tell them, don't fall ill this time around. Sincerely speaking, in the spirit of honesty, doctor, it is worrisome. The rising cost of healthcare generally has impacted vulnerable populations of this country. Let me say this, sir. Many families are forced to choose between food and medicine.
Thank you, Pastor Shola Makinde. 0815-032-0226. We'll take just one or two more. Then the Honorable Minister will attend to that, and then we'll wrap up the program this morning. Hello, good morning. Thanks for calling, sir. Your name?
Yeah, I'm about to go away. Good morning to you.
Thank you very much, Pastor.
And God bless you. I'm an apostle. I'm not a pastor.
Okay, Apostle, good morning.
Yeah. You see, what are you doing concerning this medical tourism?
Medical tourism.
People still go abroad for treatment. Presidents, ministers, commissioners, and so on and so forth. But you don't see people coming to Nigeria for treatment. If I would have told when people who come to Nigeria for medical treatment, when we will stop going abroad for medical treatment, for God's sake.
Okay.
1960, God are independent. Socially important. And still, we still depend on abroad hospitals. Why don't we have 5-star hospitals? Before you go, Dr. Salako, let's have 5-star hospitals in Abuja, in Abeokuta, in Ilaro. Give
Okay.
us your constituency.
Okay. Thank you so much, sir. Thank you very much, Apostle Taiwo. We'll add one more, sir. 0803-437-9453. Thanks for calling. You are there already. Good morning. Hello, 0803-437-9453. Good morning. Quickly, because of our time. Very, very short.
Good morning.
Yeah, this is first of comrade, the only one from what you get. On the issue you are discussing this morning, let me have my take this way. For that, everyone know that everyone know that the items, they are like high cost of food items from the market. And maybe the other side, one of the parts of restaurants, eating, drinking, dining, and whining with a lot of fun. Despite the high cost of food, we should make sure that we do not patronize substandard food items, products, or among others. Also, there is need for us to check out for expired dates of solid items as well as packaging to avoid damage to our health. There is also need for us to eat avoidable and measurable amount of food, which our stomach can easily digest. We must also balance our diet.
Okay.
Variety of food that are very cheap in the market.
And
also, we must take exercise as one of our parts, at least 30 days and muscle.
Okay.
In terms of
Thank you very much, Ridwan. Thank you very much. The Honorable Minister for Health already has explained all. Go with calls this morning. Dr. Salako, permit me to quickly acknowledge Ian Akinola Olawumi and Kehinde Damilola Olorun Jubelo. These individuals are on our Facebook page. They are following us, and they said the minister is doing very well. He's doing well, and they say he's doing excellently well, and they are commending you. Okay, another set of people that have just come back. Okay, quickly, we have Tunde Kamarudin came back again and said you are doing well. They are watching and following us on our Facebook page this morning. Honorable Minister, you have Akin Tunde from Oshele saying buying drugs away from the hospital despite the NHIS scheme. Then you're going to look at that one along with the high cost of healthcare, as been said by Pastor Shola Makinde, saying they should take subsidy from petrol. Quickly.
All right, thank you. Those two questions are related. Happy to do a question. Apostle Pastor Shola Makinde.
Yes.
They are related. First is, let me tell you that we have what we call the Basic Healthcare Provision Fund,
Okay,
which provide that 1% of consolidated revenue is set aside to fund basic healthcare. And this year alone, the federal government must have disbursed close to 50 billion to different states. to ensure that vulnerable people are captured under the health insurance scheme. So you see that across the nation, all the 36 states of the federation now have an health insurance scheme, and most of the funding for that health insurance scheme is coming from the basic healthcare provision fund that is provided on a quarterly basis to these hospitals. Some primary healthcare centers have been identified, and on a monthly basis, some amount up to 1 million is made available to some of these health centers to procure drugs, to procure logistics, to pay ad hoc staffs, and for monitoring and evaluation and all those stuff that they need to do. So the basic healthcare fund is doing a lot of that. And in the coming year, because of the reorganization that is coming, I'm going to tell you that you will see more funds available within the basic healthcare fund that's going to be disbursed to states to use to fund health insurance of vulnerable people. We have also established what we call the Vulnerable Group Fund, which is a fund that is set aside to take care of people who are within the low and income level, vulnerable people. And it's because from that you have this scheme. For example, we have the scheme of free cesarean section for people who need it but cannot afford it. So that is a part of it. We are also in the new year going to be, that the ministry has been renamed from Ministry of Health to Ministry of Health and Social Welfare.
Yes.
That social welfare aspect of our name means that we need to also take care of the social welfare of the people. And the people who need this most are also the. So we are going to set up the Social Action Fund. In fact, I can tell you the Mr. President has approved the setting up Social Action Fund that is going to be used at community level. The community will identify needs within health sector. It may not necessarily be health sector in your community. Yes, it's not directly health, but it is helping health when you have good water. If you need toilet in your community, yes, it is not directly health, but when you have good toilet, it is helping health. So such community level projects are going to be implemented using this social action fund that has been approved by Mr. President.
Finally, sir, Apostle, I'm already talking about medical tourism quickly because of our
Yes,
time.
the medical tourism. Well, first is that the world is a global village, and really you cannot prevent anybody from moving to anywhere so long as they can afford it. But what I can tell you is that what we are doing on the health sector now, for example, the cancer centers that we are setting up, when they go fully on stream, anybody who needs cancer treatment, who travels out, will just be all the resources in Nigeria.
So we should expect more of such.
Yes, definitely. You are going to see a reversal of the direction of medical tourism with the kind of thing that Mr. President has put in place for the health sector.
Your take home this morning, sir.
Yes, my take home. One of the greatest assets that any individual can have to protect your health, to maintain your health, you cannot depend on government. You also must take action by ensuring that you live a healthy life. Your habits are health promoting. You should also ensure that every time, if you use a car, if you have a car, you normally on a periodic basis take your car to the mechanic to check up.
Yes.
You must also periodically take your body as you take your car to the mechanic, which is the doctor, for checkup. Those are essential elements if you want to live quality health.
Okay, Dr. Ishaq Adekunle Salako, I want to sincerely this morning for being our guest on this auspicious occasion of the last edition of Sunday Morning Live for the year 2024. We will want to have you probably in June next year, half-year appraiser of your activities, of all what you have highlighted this morning. Maybe we'll invite you again, maybe around June, about, to come back and tell us the scorecard, how far you have gone about all these juicy and beautiful programs you have enumerated in the course of this program this morning. Thank you so much, Dr. Salako, the Minister of State for Health and Social Welfare. He's not alone in our studio this morning. He's accompanied by my very good brother and friend, Wale Junaid. Dapo Fashola is equally here, Joshua Akiola is here, Mael Salako is here, and my big brother Koke Babalola is equally here. This morning, I have the general manager herself as the executive producer of this program. Yes, thanks for coming, man. Tony Shubeson is here as our general manager. And then the producer of this program is the assistant general manager, news and current affairs. I have Benga Oshidele. And the deputy general manager, marketing services is called here, Mr. Niya Musha. Samuel, pressing the right buttons as our studio manager. Folake Shoeton has ensured we appeared on all our social media platforms this morning. Bola Jeze has called work with me as the announcer on duty. So yeah, thanks to my editors in the newsroom and to all the technicians who have made sure that this transmission is successful. My name is Wole Otayemi. By the grace of the Almighty, we shall all meet in the new year. I will say Happy New Year to you all in advance. Good morning and have a pleasant Sunday. God bless you, sir.